Hey guys, Tony here. So in this video, I want to talk about developing a fee schedule for your private practice. Now, whether you're going to be a mobile clinician going to treat patients in the patient's home, or you're going to have a brick and mortar clinic, every practice needs to have an established fee schedule. Now, you could call it a charge sheet, a fee schedule, a pricing rate, whatever it is, there needs to be some methodology behind it. Now, in this video, below in the description, I'm going to post a link to an article that was written that probably will give you far more information than you care to read, but there is an established methodology to doing this correctly. Now, I'm going to leave that as the resource. In the meantime, I'm going to tell you how most people do it and some general guidelines on what to look for. What most people are going to do is one of two options. Either they're going to call around to friends and peers, co-workers, other clinicians. They're going to say, hey, what are you guys charging where you work? They're going to take that and they're just going to copy it. And that's going to be their charge rate, their fee schedule. Or they're going to look at the Medicare published allowed amount for a participating provider. They're going to use a 2 to 2.5 times multiple and just randomly make their fee schedule 2 times the Medicare allowed amount. So if Medicare allows $38 for a unit of therapeutic activity in your area, they're going to double that, and that will be the rate they charge for therapeutic activity. Now, certainly there isn't a lot of rhyme or reason behind that methodology, but it's effective, and that's what most people are doing. If you want to understand the big picture, however, let's go through it from the top. So you're going to establish a fee schedule that will set a price on a per unit basis for each procedure you will provide. You can set an established price. Maybe you're going to say $50 for every timed code, maybe $30 for an untimed code, and $150 for an evaluation line item. The evaluation might be 97161 for therapy, PT, 97162, 97163 for min, mod, I don't even know what, high level complexity. But either way, so you're going to have those rates. And then what's going to happen is, technically, if a client walked in the door and said, I would like to hire you to provide services to me, that would be the rate that client is billed. You are allowed, based on published guidelines, to provide what's called a prompt payment discount. Oftentimes, if you go to a hospital and a procedure is performed, then let's say the allowed amount, let's say the charge rate is $10,000 and the allowed amount is $5,000. And they say that if you make a payment today, pay the full amount on a credit card or check or cash, we'll reduce it by 40%. That's called a prompt payment discount. Google search that terminology and find the guidelines behind it. In our Facebook group, I've published some literature on it. I don't have the time to get into it right now. But other than that, if a patient walks in off the street, no insurance, and they say, I want to hire you to provide your service, you're going to charge them the rate. You'll send them an invoice. They're going to pay that rate. That is the way business is conducted. Now, in terms of insurance contracts, because the insurance payer is hiring you to provide services for their beneficiaries, they're expecting what I would consider a high volume discount. So if United Healthcare enters into an agreement with me where I'm a therapist providing services to United Healthcare beneficiaries, I will typically agree to a discounted rate specifically for those beneficiaries of that plan or that policy. In that case, it might be a 50% discount, it might be more, it might be less. Typically, the bigger the third-party payer subscriber base, the more members they have, the larger discount they expect. To give you some rough numbers, in my current networks, I have some third-party payers that have offered to pay me $12 a unit for 1 unit of therapeutic exercise, a 15-minute unit. I've got other third-party payers with smaller subscriber bases, smaller footprints in my area that have agreed to pay me $25 for a unit of therapeutic exercise. I've got yet other payers who are willing to pay me my full bill amount, upwards of $50. So it's just going to depend on how the contract is structured, how large typically the subscriber base is, how many physical therapists, occupational therapists, speech language pathologists they are allowing into the provider network. So a payer network might have 1,000 subscribers in your area. They don't have a lot of bargaining power with that. But if they have 100,000 subscribers in your area and they only allow 3 outpatient physical therapy clinics, you can assume you're going to receive a higher volume of those referrals, which means that they're going to expect a larger discount on your charge rate. So just to review, you establish a fee schedule. The most common methodology that is the most simple is you look at what Medicare reimbursement is, you do a 2 to 2.5 times multiple on what Medicare allows, and that's your charge rate. And then from there, you establish discounts based on payer contracts. If you're getting into a third-party payer system, you can establish a prompt payment discount as long as it's applied universally across all of your patients and you follow certain guidelines. Look at the link in the description for more information on that. But that's it. If you have more questions about it, if it's still not clear, please let me know. Post your questions in the comments on YouTube, subscribe to the channel so you get notifications when I post new videos, and hopefully this starts to shed some light on how the fee schedules are developed and how they work. Guys, as always, I appreciate your time. Thanks for watching.